Listen carefully, because what just happened in Oregon isn't just a local hospital dispute. It is a warning flare to the entire American healthcare system. A hospital replaced its long-standing emergency physician group with a corporate management company. Not because the physicians suddenly forgot how to save lives, not because patient outcomes collapsed, because corporate leadership decided control of the emergency department and should move from medical professionals to a management firm. The medical staff responded with something rare in modern healthcare: a vote of no confidence. I want you to let that sink in. The physicians inside that hospital looked at leadership and said, "We no longer trust you to protect medicine." So why does this matter? Because across the United States, healthcare is being quietly transformed into a corporate asset class. Private equity firms and corporate management groups are rapidly moving into hospitals and medical practices. And when that happens, something dangerous begins to creep into clinical environments. It's called profit models, cost optimization, operational efficiency metrics. Those words sound harmless in a boardroom, but in a trauma bay, in an ICU, in an emergency department, they translate into real consequences: staffing levels, clinical protocols, throughput targets. And the most dangerous shift of all: medicine slowly moving from clinical judgment into financial strategy. Now understand something clearly. Healthcare systems will tell you this improves efficiency. They will say things like it stabilizes hospitals. They will say it modernizes healthcare delivery. But frontline clinicians across this country are asking a very different question. Who is making these decisions? Is it the physician at the bedside, or the executive looking at the quarterly earnings report? Because when corporation controls medicine, there is an unavoidable tension. One side answers to patients, the other answers to investors. And those two missions do not always align. That is why this Oregon conflict is becoming a national legal test. The state recently passed laws aimed at limiting private equity influence in healthcare. Now the system is being forced to confront a question most leaders would rather avoid. Who truly controls American medicine? Is it doctors, hospitals, or corporate ownership structures hidden behind management contracts? Here's the uncomfortable, very uncomfortable truth. Clinicians helped create this environment. For decades, many stayed silent while administrative layers expanded. While executive compensation exploded. While financial engineering quietly reshaped healthcare. Now, the consequences are arriving at the bedside. Emergency departments, operating rooms, clinical staffing models, all increasingly influenced by corporate strategy. But silence isn't a strategy anymore. The future of medicine will be decided by one simple question. Will healthcare remain a profession or fully become an industry? And that decision will not be made in boardrooms alone. It will be made by clinicians willing to speak the truth about what is happening inside the system. Because protecting patients requires something many institutions have already forgotten: courage. And the willingness to say what others are too afraid to say. This is exactly why movements like the Nursing Special Forces Association exists. To protect the protectors and to ensure the people delivering care never lose their voice inside the system they hold together. So the question now isn't whether corporate medicine is coming. It already has. The real question is, who will defend clinical integrity when profit begins shaping patient care? Because the front line is watching. America is watching. And the silence is ending.